Good afternoon. Today's video is going to talk about the Village's Back to Normal plan. Last week, a state court declared the governor's consecutive executive orders void. At this point, that means the economy is completely open. This is similar to what happened in Wisconsin. However, it was not the Wild West in terms of opening in Wisconsin. Instead, each local government gave local guidance. Similarly, we think it is appropriate to provide guidance on opening. It is important to note that this is guidance. The plan represents the Village's best efforts to provide guidance for businesses and residents. While adherence to this guidance is recommended, compliance is voluntary. We strongly recommend that all businesses conduct an internal analysis to determine other steps that can be taken to help ensure employee and customer safety. Advisors such as risk managers, insurance companies, industry groups, the IDPH, and safety consultants may be helpful in this. At the end of the day, it is the Village Board's job to provide residents and businesses the best information we have, but it's up to each of them to make individual decisions and take individual responsibility. Consumers and businesses will determine what is appropriate. If a business requires you to wear a mask to enter, that is their right. If you don't want to wear one, then don't consume from that business. Alternatively, if a business does not require a mask, that is also their right. If you don't want to shop there because they do not require masks, then don't shop there. The important thing here is that instead of one person dictating the guidance, the legislative body, our Village Board, approved it. That is the way that our system is supposed to work. This guidance is sound and based on expert guidance, research, and dialogue. We will continue to monitor the data and determine the appropriate guidance in the future as we continue our march back to normalcy. Now, I would like to run you through the current data and numbers regarding the COVID-19 situation. COVID cases in suburban Cook County have steadily trended downward for over a month after peaking in the last week of April. For the last few weeks, they have been flat, as you see in this slide. Testing percentages have averaged around 2.6 positive across the entire state. In Orland Park, it's 4.3% for the last 14 days. But as you can see, testing percentages have remained very flat and low for quite some time. The daily COVID hospital admissions in suburban Cook County have trended downward for months, and they peaked about the last week of April. Currently, they're negligible. The last few days, there have been no reported cases in the hospital due to COVID. COVID-related deaths in suburban Cook County have steadily trended down for 2 months after peaking about the first week of May. For over a month, Illinois ICU bed and ventilator usage by COVID patients has been flat or declining. It is well below where our peaks were back around the 1st of May. ICU beds and ventilator availability likewise have not been an issue for well over a month, and the state requires them to be over 14%, and as you can see, we're well beyond that threshold at almost 40% with ICU beds and over 70% with ventilators. So hospital resources are not an issue. I want everyone to remember that the reason why we did all of this, the social distancing, shutting down businesses, was to make sure that our hospital system was not overrun. This shows that our hospital system is in great shape, and the experts actually tell me that we could handle a high flu season in the present state. The last COVID-related death in Orland Park was almost 1 month ago. We do have 34 deaths in Orland Park. 33 of them are in long-term care facilities. The average age of those deaths is 83.8. So as we've talked about before, this disease particularly attacks our elderly population, our infirm population, and those in long-term care facilities. Long-term care facilities represent 55% of the deaths in the state of Illinois and 97% of the deaths in Orland Park. The case fatality rate is 16.9% in long-term care facilities. The other thing that's important to know in Orland Park is that 97% of the deaths actually had a serious illness before they contracted COVID. So again, comorbidities are very important. According to the CDC, people over 60 should stay at home until the economy is reopened because 93% of U.S. deaths are age 55 and up, as you see here. And that's through June 27th of CDC reporting. Cook County and Illinois data confirm that COVID becomes significantly more dangerous with age. As you see, nearly 50% of the cases over 70 years old end up in the hospital, and up to 30% of the cases, over 30% of the cases over 80 pass away once they get to the hospital. Since February, there have been more deaths from influenza and pneumonia than there have been from COVID-19 in every age group reported by the CDC. The reason I show this is so that you understand that, yes, COVID is dangerous, clearly, you can see from the numbers, but also it's not something that we don't deal with on a regular basis. Flu and pneumonia do this to us every year, and we don't have a similar response. So we need to think about that as we look to return to normal. Now I'd like to talk a little bit about our opening plan, and I'm just going to highlight the differences, which aren't a lot, but I'm going to highlight what few differences that there are, and you can always link to, and I encourage everyone to link to our website and read our actual plan so that you understand, particularly if you're a business, so you understand what our recommendations are for keeping your business and your customers safe, and also as a customer so that you can make sure that the businesses that you are consuming from are taking the steps necessary to keep you safe. The biggest differences between the Village's plan and the CDC's plan are driven by the recommendations of the CDC. The CDC recommends a waiting period between phases of 14 days. As we've discussed before, the governor's plan was 28 days. Metrics used to determine moving to the next phase are consistent from phase to phase. So every phase in the CDC recommendations uses the same metrics, which include the numbers that I've showed you, which are cases, hospitalizations, death rates, ventilator availability, number of people on those ventilators. So all of those things are important. Also test positivity rate. So all those things are very important. The other thing the CDC recommends is that vulnerable populations should shelter in place until we're fully reopened. Vulnerable populations are defined as those people who are over 60 or are immunocompromised or have comorbidities. So it's important for people who are sick, who are elderly, or who are immunocompromised to make sure you shelter in place as much as you possibly can and make sure you protect yourself from this. Because as we open more, you can potentially be more exposed if you just go out in the general population. So still try to make sure you keep your social distance. Also, the CDC recommends nursing homes should not allow visitors until we're fully reopened. Those are really the differences between our plan and the Restore Illinois plan at a high level. The key differences currently in our plan include the fact that all of our businesses are now open. And several businesses have changes to capacity. So when the Restore Illinois Phase 4 came out, they restricted some capacities more than they first indicated they will, and they also kept some businesses closed that they first had indicated would be opened. So that's where our plan differs from them a little bit. So indoor entertainment facilities are now open up to 50% capacity. Those that were closed, i.e. Gizmos and Sky Zone were closed, are now free to open. Also, other businesses have bumped up to 50% capacity with no minimum cap on the number of people. The Restore Illinois plan said 50 people, and for example, at Orland Bowl, 50 people is an awfully low number of people for a facility that size. So what we've restricted to is 50% capacity, which is what you see in most recommended plans in the nation and in other states, and also recommended from the government. Restaurants will be open to 75% of their fire-rated capacity, but that also includes employees, not just patrons. But seating should continue to social distance of 6 feet between tables and a max table size of 10 people. There should be no standing room areas in the bars, and that area should be restricted to 25% seating because we do know that bars are potentially a problem. Now the good news is for Orland Park, we really have no facilities that are bars only. Everyone is also a restaurant. So that makes us a little bit different than the areas of the country that are having problems in bars alone. Outdoor venues are also open to 50% capacity, provided social distancing limits can be maintained. Now what's important about this is the Restore Illinois said outdoor facilities can only hold 20% capacity, but yet indoor facilities could hold 50% capacity. Now one thing we know for sure is this doesn't spread very well outside, but it's indoors with prolonged contact in tighter spaces. So it makes no sense to me that there's a 50% capacity indoors, but only a 20% capacity outdoors in a park like Centennial Park West. So those are the key differences between our Phase 2 and what was the Restore Illinois Phase 4, which has been declared void by the courts. We continue to recommend that CDC guidance is followed. Nursing homes should not allow visitors until you're fully reopened. That's per the CDC recommendations, as I'll remind you. We recommend that seniors continue to shelter in place and other vulnerable populations, again, per the CDC recommendations. Also, if you are sick, stay home. That is probably the most important thing. If you're sick in any way, stay home and stay away from your loved ones. Wash your hands or sanitize with alcohol-based Sanitizer, much more frequently than probably you did before this. Social distance whenever possible to 6 feet. Another step you can take is you can wear a cloth face covering when social distancing can't be maintained, particularly in indoor settings, but not when you're exercising. Don't put yourself at risk by having a difficult time breathing with masks. We've already had some issues with that. So again, cloth face coverings do not replace social distancing. Social distancing is the most important thing to do. However, if you cannot social distance, particularly if you're indoors, please then consider wearing a mask. Masks are not a solution for social distancing. I want to repeat that one more time. It's not a solution for social distancing. It doesn't replace it. It's something that augments it when you cannot social distance. And with that, because masks have become so political, I'd like to talk a little bit about masks. Somehow, as I mentioned, the wearing of cloth masks have become the latest attempt to divide people and create a political issue. You hear things like you're willing to kill people, you want people to die. This is absurd. Nobody I know wants to hurt anyone, and nobody wants people to die. The state of Illinois, IDPH, states that the CDC now recommends wearing cloth face coverings in public settings when other social distancing measures are difficult to maintain, especially in areas of significant community-based transmission. Interestingly enough, Orland Park is not considered one of those areas with significant community-based transmission. We're considered low to moderate at this time. However, it's still not a bad idea if you cannot social distance. The IDPH goes on to state that the most effective measures for preventing further spread of COVID-19 are to stay home when you are sick, maintain physical separation between people while out in public, and frequently washing hands with either soap and water or an alcohol-based hand rub. According to our legal advice, as well as the advice in most of the towns around us, enforcement of the mandatory wearing of masks is a likely violation of the law. In my opinion, it is a lot more helpful to get everyone the facts and allow them to make their own informed decisions and accept personal responsibility. Unfortunately, the information coming from the CDC and WHO has been changing regularly, and they never admit what they don't know. I do think that's unfortunate because we lose some faith in what they say. With that said, I will summarize their latest guidance. First, according to our research and all the health experts I talked to, there are 0 scientific studies on the effectiveness of cloth masks. They are also not included in the pandemic training that the CDC created prior to the coronavirus. They talk about social distancing, they talk about other measures, but they do not talk about the wearing of cloth masks. Regarding the use of cloth masks, the WHO and the CDC agree that cloth masks do not protect the wearer from coronavirus. That's important to note. Cloth masks also do not do anything if a person is healthy. Cloth masks help stop the spread of the virus if someone who is sick coughs or sneezes. This can also be accomplished by covering your face with a cloth or into your elbow. It doesn't hurt to wear it if you can't social distance, particularly in indoor settings. The WHO guidance on masks is extensive, and it is as follows. Medical masks. Medical masks should be continuously worn by health workers who work in clinical areas during their routine activities. Staff who do not work in clinical areas do not need to use a medical mask during their routine activities. They recommend that persons with any symptoms suggestive of COVID-19 should wear a medical mask, self-isolate, and seek medical advice. Vulnerable populations, people over 60 or with underlying comorbidities, should wear a medical mask for their protection where physical distancing cannot be achieved. So, medical masks are what protects you. Medical masks should be worn by health workers who are engaged in clinical activities, but not for the ones that don't, and for people who have symptoms or for people who are vulnerable and over 60. So that's what their recommendation on medical masks are. So the recommendations on non-medical cloth masks are as follows, or not their recommendation, but the potential benefits from the WHO are as follows. Cloth masks have the potential benefit for source control, i.e. sneezing and coughing, for the general population in public settings like grocery stores, gatherings, closed settings, churches, mosques, etc. People living in cramped conditions, such as refugee camps and slums, those things don't apply to Orland Park. General public on transportation, so bus, planes, trains. So if you're on public transportation, not a bad idea to wear a cloth mask. They list several benefits of healthy people wearing masks. One, it reduces the potential exposure risk from infected persons before they develop symptoms, i.e. this is people who think they are healthy and are not. It reduces the stigmatization of individuals who are wearing masks prevent infecting others or themselves. So it makes people feel less alone if they're the ones that are wearing the masks. It does make people feel like they can play a role in contributing stopping the spread of the virus. It reminds people to be compliant with other measures. The potential social and economic benefits by encouraging the public to create their own fabric masks may promote individual enterprise and community integrations. So that's from the WHO. Those are their recommendations. If you noticed, there are no benefits for someone who's healthy. The benefits are really if someone thinks they're healthy and they're not. That's the one thing that's a benefit. And otherwise, it makes us feel better to do it. That's the important thing from the WHO. Non-medical cloth masks also have some potential harms, according to the WHO. It has a potential risk of self-contamination due to the manipulation of the face mask, because a lot of us, when we have the face mask, which I have here, we touch it. And when we touch it on the outside, then we can contaminate it, and then it's not doing anything anymore. Also, potentially touching our eyes or whatever with contaminated hands. Potential self-contamination if they're not changed, if they get wet or they're soiled. A potential headache and or breathing difficulties, which some of you may have experienced. Potential skin lesions or acne. Difficulty communicating, clearly, I think we've all experienced that. Potential discomfort. A false sense of security leading to potentially lower adherence to critical preventive measures such as physical distancing and hand hygiene. I see that all the time. People think by wearing this, then they don't need to social distance anymore, and they get in your space and all that. As I've pointed out several times, this is not a replacement for social distancing because it really doesn't do that much. There's also poor compliance issues, specifically among children. There's also waste management issues. We've all seen masks on the ground in places. There's also difficulty communicating for deaf people who need to lip read, and there's also disadvantages for people wearing them, children, elderly persons with cognitive impairment, those with asthma or respiratory problems have problems. Those who live in hot and humid environments like we've been in now, those can be difficult. So those are some drawbacks of masks. So how do you sift through all of this information? At the end of the day, the bottom line is, if you are in a cramped space and indoors, it doesn't hurt to wear one. But if you are in fact healthy, it really doesn't do anything for you because it won't protect the healthy person. It does protect others from you if in fact you think you're healthy and you're actually asymptomatic. So that's a summary of cloth masks. So that was a brief update on masks and all of the guidance that's available out there now on the usage of cloth masks. I'd like to get back to our plan and point out that the plan represents the Village of Orland Park's best efforts to provide guidance for businesses and residents. While adherence to this guidance is recommended, compliance is completely voluntary. We do, again, strongly recommend that all businesses conduct an internal analysis to determine other steps that need to be taken. This plan, as well as other COVID-19 recovery plans, are subject to change based on newly acquired data or circumstances regarding COVID-19. We check that information regularly, and if we need to make changes, we'll make sure that the public is aware. Updates will be posted on our website at www.orlandpark.org. As always, if you have any questions about the plan, you can email our public information office, the village manager's office, or the mayor's office, and we will get you the relevant information. You can also find the plan on the website under the coronavirus tab. Thank you very much. Keep doing what you're doing. It's gotten us to this point. If we continue to social distance, we will be able to continue to reopen. I'm looking forward to opening even further and hosting our concerts in August and September and other events and adding more capacity to our businesses as we go. Thank you very much and have a good afternoon.